How do I check if I need to go to the hospital for COVID-19? COVID-19 can affect your lungs. Your lungs help you breathe and maintain your oxygen levels. You can measure your oxygen levels with a device called a pulse oximeter. We need oxygen to stay alive, and if your oxygen levels are low, or if it's difficult for you to breathe or speak in full sentences without getting short of breath, you may need to seek medical assistance.
How do I measure my oxygen levels or interpret numbers on my pulse oximeter? A pulse oximeter is a small device you can clip on your finger, which can measure both your oxygen level and your heart rate. You unclip the device and place your finger in the center of it as demonstrated. Wait for 1 minute till a steady number appears. It can be confusing at first to know which number means what. The number that says SpO2 or O2 tells us the oxygen percentage level in your blood. A normal number is between 95 to 100%. If your number is in this range and you can speak full sentences without getting short of breath, it is very reassuring. The other number the device shows is your heart rate. This may say HR or heart rate or PR, pulse rate. A normal number is between 60 to 100 beats per minute. It can be confusing to know which number is your oxygen level and which is your heart rate. And each device looks different. If there are instructions with your device, it is helpful to check this out or confirm with a trusted medical source if you are not sure.
How do I know if the number I'm reading on the pulse oximeter is accurate? Sometimes these numbers keep changing. If that happens, try to adjust the pulse oximeter by getting a snug fit on your finger and wait until the numbers stop changing before you take your reading. Be careful to use a high-quality pulse oximeter. Some are not very reliable. It is better not to have one than to get false information. For more information, please visit the website fda.gov and read about pulse oximeter accuracy and limitations, FDA safety communication. The quality of the reading you see may vary. If your device has a display with a waveform with rising and falling bars, this may be helpful. Typically, a smooth waveform or the greatest number of bars suggests a good reading.
What are the other things you can do to ensure a better reading? Maintain the pulse oximeter on your finger for at least 1 to 2 minutes after resting. Ensure that your hands are warm, and ensure that there is no nail polish, henna, or dark color on your fingernails. Ensure you are looking at the numbers straight up, and ensure that your device has enough battery life. You can confirm with placing it on a different finger as well. Compare your oxygen levels while at rest and after walking around your house for 2 minutes. It is normal for readings to change between each check, but if your numbers are greater than 95% and you do not have other breathing problems, that is very reassuring again.
When should I seek further medical assistance? As a reminder, an oxygen level of 95 to 100% is normal and indicates that you're getting enough oxygen. However, if your oxygen level is between 91 and 94%, either at rest or while walking, this may be concerning, and you should talk with your doctor as it may indicate the need for more assistance. If your oxygen levels fall even further and are less than 90%, you will likely require oxygen therapy. People with an oxygen level of less than 90%, or those having difficulty speaking or breathing, or pain or pressure in their chest or confusion, or other unusual symptoms, should seek medical assistance immediately.